Hello, my name's Denise Mathewson. I'm a licensed social worker. I have had the pleasure of working for 32 years in the child welfare area, working mostly with children and families in foster care or having trauma in their households for a period of time. I also had the opportunity to work with um, children that have been adopted. I've had a lot of conversations and one on one work with individuals seeking information from their past and trying to come to terms with sort of what has happened to them. And as that opportunity presented itself, and I returned to school to earn my master's in social work, I decided upon graduation that I would continue doing the work that I had been doing for so long, but also expanded my knowledge and began working with a home care agency that provided individual therapy and sometimes referrals to needs within the community for patients once they return from the hospital. Things like grief counseling and getting comfortable with the situations in which they now find themselves. Those are areas that we dealt with on a regular basis. Some of these individuals dealt with significant health issues as well as some psychiatric problems and interventions. And I just found I loved the one on one work. I had been doing so much group work and focusing on different areas, and this just really whet my appetite. So, about a year and a half ago, I applied and began working, doing one on one therapy with a local agency, and again, just really fell into a groove in which I enjoyed so much working with individuals. I've seen mostly adults and some couples, and although I don't typically see couples for therapy, I still have much to learn in this area to be able to be helpful when couples are in crisis. But what I have been able to develop over time is some really good tools to help individuals within their marriages and relationships and just working with their partners, and have continued to learn some tools, some steps, some things that can benefit them. Communication just tends to be the biggest issue that individuals have, and being able to help them reframe, refocus, help them understand what's happening in their life has been really helpful to them. It's also provided me just a better framework to know how to help and guide individuals. I really truly believe that individuals possess within themselves the ability to heal, to grow, to improve their situations, and coming alongside individuals to help them to do that has just been so um, I have just enjoyed it so much. I'm not even sure exactly how to say it, but I being able to watch these individuals connect with some of the past traumas in their life and then help them to move forward and develop new skills. It's just been a joy to watch this happen. I really typically prefer to work with women, but I am not uncomfortable working with men as well. But being a female myself, I tend to have a little more understanding, but I've also enjoyed the ability to work with some men and help them recognize things within themselves that they really do have control over and can change in a positive way and have uh, better relationships and feel better about themselves as individuals. I tend to use some dialectical behavioral therapy, helping people really accept their situation. We can't always change some of the details, but helping them grow to a place of just acceptance and making the best of the situation. And also have been able to work with individuals on some of the messages that they have in their head that repeat over and over when scenarios arise. And so those sometimes cognitive dissonance and cognitive behavioral therapy pieces of that I try to pull in at times. I love to learn and I love to hear what individuals bring to the table and how together we can develop a plan to make their situation improve. I hope this gives you a little picture of myself and what I have to offer. As far as doing online therapy, I have had the opportunity to do some of that over the last year and a half. I also have learned that for me as an individual, online therapy is super convenient and super comfortable. In my setting, in my home right now, it's quiet. There are no distractions, and there's no one in my home that can hear what's going on in this room. So it's completely confidential, and there is no concern about that. So I hope this gives you a picture of what it would be like to work with me as a therapist, and I hope that you'd give me the opportunity to so that we could come alongside each other and work together. I look forward to meeting you.